Good morning. My name is Dr. Hillel Mazansky, and I'm a board-certified physician practicing in San Diego, California. I specialize in medical hypnosis, guided imagery, nutrition, and exercise. My website being www.gianinc.com, Guided Imagery and Nutrition Incorporated.com, with keywords guided imagery nutrition. Today we are going to speak about a problem that's very pervasive, and that is depression. Depression or extreme sadness can be a devastating situation. We are not talking now about the simple sadness or depression that everyone has at one time or another during their life, where they react to a certain situation that causes sadness. We are discussing depression that is long-lasting and is severely disabling. Depression, or feeling extremely sad, is divided into two groups medically. The one called unipolar depression or major depression, and the other type is called bipolar depression. The difference is that in unipolar depression, the patients are constantly depressed. In bipolar depression, patients have periods of complete elation and excitement and acting out in a way that's usually not becoming due to their elation. And then following that, they develop the severe depression, going right the way down from one side of the scale to the opposite side with depression. The exact cause of depression is, like many things, unknown. There are theories that it may be genetic in origin, which it is. Others believe is it nature, which is the genetic or nurture, the way the person was brought up. It matters not what the exact cause is. What does matter is how one has to treat it. To start off, you are able to empower yourself to try and treat your depression by exercising and trying to increase the speed of your exercise to increase your endorphin secretion in the brain, which is the feel-good hormone, and certain foods high in omega-3 acids are also indicated. We encourage you to have your blood tested for thyroid, because underactive thyroid can lead to depression, and also to have a vitamin D level done, because recent evidence in the medical literature shows that depression is associated with a low vitamin D. The symptoms of depression are sometimes quite obvious to the person who's suffering from it. Oftentimes they are extremely tired and have difficulty in getting out of bed, have altered sleep rhythms, either overeat or undereat, are not interested in doing and involving themselves with other people or other activities, and all they want is to lie in bed away from everybody by themselves in a state of depression. Depression can lead to serious consequences, inasmuch as oftentimes the pain becomes so severe that the patients end their lives via suicide. We believe that the other three psychological conditions that are seen mainly are stress and anxiety, but it is the depression that we see in our practice that tends to be the worst. The norm for treating depression today is psychotherapy, either done by a psychotherapist or to go to a psychiatrist, and the use of antidepressant medicines. Sometimes they are very effective, and in that case, that's great. Other times, the patients do not respond, and we have seen some that take 4 and 5 different antidepressants, suffering side effects, which are then treated with further medication, and yet they still remain unproved. We offer an additional method of self-empowerment using medical hypnosis and guided visualization or guided imagery. Just last week, we saw 2 patients who had severe depression, were on multiple medications, and had been umpteen times to psychologists and psychiatrists without relief. Under deep hypnosis, both of them revealed that they had been sexually abused as children. Once that message was mouthed and the patient spoke about it, the results were truly dramatic. We saw them in follow-up, and they wanted to cease their medication. We did not allow that because we told them that they must go to their own physicians or psychiatrists to get rid of the medication if they so desired. My point being is that medical hypnosis and guided visualization does sometimes help severe depressives. It is non-toxic, it has no side effects, and it is self-empowering. As always, I thank you for listening and wish you a good day.